Hello, this is Dr. Tyler Hamill, chiropractor and nutritionist in Kingwood. Today we're going to talk a little bit about prediabetes and diabetics and what we really need to do or to look for with these kind of patients. Diabetes is rampant in today's society, and mostly because of the poor diets that we eat. Eating diets that are high in carbohydrates and sugar, basically anything that turns into sugar, is going to eventually put a lot of stress on your pancreas, which can lead to prediabetes and then diabetes. There is no stopping this process unless you change your diet. It's as simple as that. It's a difficult thing to do, but when you realize what causes diabetes, it's not rocket science. It's a simple thing that you can change and you can start today. What happens when we eat carbohydrates or sugars, it goes into our system. The pancreas will release insulin, and that causes the sugar from the blood to be taken into the cells. That gets taken into the cells, and then your insulin level goes down, and basically after that your body returns to a fat burning stage. After going through this year after year after year, if you're eating way too many carbs and sugars, your pancreas gets worn out, gets a little bit tired of producing insulin, and also those cells that take in the sugar from the blood, they get tired of seeing insulin around all the time. So eventually they become desensitized and they don't take in the sugar that they're supposed to, which means insulin's hanging around in your system, and when that's happening, you are in a fat storage stage. So you look at people today who are overweight, a vast majority or a big percentage of people are overweight today in America. What's happening? They are stuck in a fat storage stage. So what do we need to do about this? Well, first, diet modification is a huge thing. That's the priority when I work with patients that are pre-diabetic or diabetic or overweight or have a family history of diabetes. Look at reducing carbohydrates to 100 grams or less per day and eat good carbohydrates, not breads, pastas, oatmeals, things like that. Eat carbohydrates from vegetable sources like broccoli and asparagus, Brussels sprouts, sweet potatoes even, things like that, that you can get a good form of carbohydrate. It's a little bit easier on your system to break those things down. Number two, make sure that you are taking some kind of supplements that will support the pancreas and support blood sugar. The only way that you can get over having prediabetes or even diabetes is to take stress off the pancreas. Right, we need to keep our blood sugar even or level for the entire day. We do not want any blood sugar spikes throughout the day because that causes more stress on the pancreas and insulin, and that's going to give us more issues or kind of push us in the direction of prediabetes or diabetes. What do we look for on blood work? The main things we look at is glucose and hemoglobin A1C. Glucose, you want it to be below 100. Hemoglobin A1C, we want to have that below 5.6 or 5.5. I've seen diabetics in my office that have hemoglobin A1C up at 12, which is very, very dangerous. Folks, this is a simple thing to take care of. We need to limit the amount of carbs and sugar that we're taking into our bodies. Like I said, 100 grams or less per day of carbohydrates. If you're pre-diabetic, I'd go down to more like 60 grams of carbohydrates a day. If you're already diabetic, I'd go down to 30 or 40 grams of carbohydrates a day. We have seen patients in the past that have been on insulin, or a couple different kinds or forms of insulin, and they go through a program, they go through diet modification, taking supplements, and eventually they can get off of their insulin, which is pretty amazing. Lots of people don't believe that. It is hard to believe. It's hard to imagine that you could be taking an insulin medicine to help your pancreas, and eventually you might not have to take that anymore. Right? Take stress off the pancreas. That means that insulin does not have to be released. That is the way, that is the healthy way for pre-diabetics and diabetics to not only get healthier, but to feel better, feel more energetic, sleep better, have more energy. All that kind of stuff happens when your blood sugar is regulated. Again, my name is Dr. Tyler Hamill. If you are struggling with pre-diabetes or diabetes, or your blood sugar is high, or you have a family history, please let us know. You can email me at info@wellness24.org or go to www.wellness24.org. There's plenty of free information. Taking medicine, taking metformin, That may help with the symptoms to some degree, with blood sugar to some degree, but it's not really getting you any healthier. You have to change your lifestyle. You have to cut back on the carbs and the sugar. That is the only way that you can get healthier. And there's lots of diabetics who are doing that right now and feeling great, and they're active and doing things. So it is possible. There is hope for you to get better. Again, my name is Dr. Tyler Hamill. I look forward to meeting you. Thank you very much.